Hi, I'm Jackie.
I'm Emilie.
And I'm Anna-Marie, and we're Lotus Health.
As 3 women living in the United States, we often take for granted the services in place to protect the health and safety of women.
When we have children, we know that the medical services in place will do everything in their power to ensure mother and infant safety.
In many parts of the world today, however, this experience is a luxury.
In some parts of the world, a woman's identity may be tied closely to her ability to bear children, yet access to basic obstetric care is often unavailable. Within impoverished areas in India, at-home deliveries are a common occurrence. This leads to high maternal mortality as well as high counts of debilitating complications that jeopardize a woman's health. One of these conditions is called fistula, a loss of tissue that results from hours of unattended obstructed labor. Fistulas most commonly result in stillbirths and leave the woman marginalized from society, as she will suffer from permanent incontinence if the injury is left untreated. Because their bodies are not developed fully enough to bear child, young girls are at the highest risk of suffering from fistula after labor. In areas of India where adolescent fertility is high, fistulas are not an uncommon event. If unaddressed, these injuries can lead to lifelong suffering, leaving women as outcasts in society.
The UNFPA recognizes 49 countries in their campaign to end fistula. While India is on this list, there are no medical centers that exist today specializing in fistula repair. Additionally, there are no formal databases to track the incidence or prevalence of fistula.
Beyond the limited data collected by the UN representative for India in 2007, there continues to be little information available to substantiate the funding required to build fistula medical centers.
We, as Lotus Health, are an outreach organization aimed at addressing the underreported occurrences of fistula. Our goal is to empower women who are suffering and prevent future occurrences of fistula.
Overall, our model is made to be cost-effective and sustainable while empowering women. It begins with a core team of 3 full-time health ambassadors. We hope to leverage already established relationships between trusted NGOs, such as Care India, and villages, to expedite the process of becoming a trusted health advocate. The team of health ambassadors will learn how to educate women in impoverished areas on general information regarding proper maternal health, such as the importance of delivering at a medical facility, and they will also highlight the elevated risks for adolescent females. The community leader will be the bridge between local communities and Lotus Health, who will identify girls who are at high risk for complications such as fistula while collecting data and information on such cases. They will also help coordinate transportation to local medical centers. Each community health leader, once identified, will be provided with a kit. The kit includes many items, including information on fistula and maternal health, materials to collect data regarding fistula incidences, and a cell phone, which will generate revenue by acting as a community phone for a fee to pay for the transportation costs for women who cannot afford to pay the bus ride to a medical center. Lotus Health's model will work to empower women while collecting the data necessary to inform governmental and international organizations of the crucial need for funding to build facilities for treatment centers like the Addis Ababa Hamlin Center in Ethiopia. Bihar is an example of the type of area in which we would begin our program because women are offered cash incentives for giving birth at institutions, and of the 40 million women in Bihar, over 50% are younger than 25, meaning the region is likely to have one of the greatest incidences of fistula.
Our budget for the first 3 years includes allocating money in 6 key areas. We plan to start with 3 ambassadors, each of whom will be compensated $800, which means $2,400 per year. Ambassadors will also be required to attend a 2-month training to prepare them for their role in education and data collection. Travel to remote locations where transportation is limited poses a real challenge to Lotus Health's mission. To address this, we will equip each ambassador with a vehicle, an initial investment of $4,500 for the first year. A unique component of the program is that it equips each of the 15 villages with a cell phone. At a cost of $200 each, or a total of $3,000, these phones will enable the village primarily to communicate with hospitals and Lotus Health ambassadors. However, it will also generate income for the community leader, where the phone is allowed to be used for a fee. A physical office at a cost of $500 will bring awareness to the program and provide health ambassadors a home base. And finally, each village will receive a kit to be used as a reference for maternal health care and fistula prevention. This will cost $450.
With this grant, Lotus Health plans to reach 5,000 young women and measure our success by tracking fistula cases, the extent of our reach, as well as financial stability.
Access to healthcare is not only important to the woman, but to the community as a whole.
Thank you for taking the time to consider our project.
We hope to make this a reality.